This is South Sudan, a country rich with natural resources, talent, resilient people, and a promising future. In the past 20 years, the government of South Sudan, the Global Fund, the United Nations Development Program, UNDP, and other partners have worked together to combat HIV/AIDS, tuberculosis, and malaria. This is a journey of hope, progress, and collaboration.
This year we're marking 20 years of the Global Fund based on this agreement that was signed back in December 2003.
We started the partnership with the Global Fund when we were still part of Sudan.
By then, the war of liberation was raging on. The health facilities were almost non-functional. Some of them were doing it under trees, or you could put some tents. At that time, we had a situation. Cases of HIV/AIDS were increasing.
From 2005 to when we gained our independence in 2011, July 9th, HIV, TB, and malaria were the main burden, and they still remain a huge big burden until today. If somebody walks into a healthcare facility and they find out that they have got HIV or AIDS, it was almost equivalent to a death sentence, because there was no treatment, there was no management. Even if there was, it was barely enough.
Primary healthcare units were basically operated by community health workers and maternal child health workers.
During that time, the health system was really very weak at that time, I have to say. There were no actual systems built at that time.
Looking at the underdevelopment of the country by then, I should say laboratory services was just point of test at hospitals. There's nothing like networking of laboratory services in the whole country. So all you had was establish a hospital, put a microscope there, and they call that is laboratory services.
The country had suffered from decades of war and violence, conflict, and this really destroyed a number of infrastructure. Populations were displaced, experts and the technical staff had left the country.
The demand was very high. There were even very few people that were enrolled on treatment. There were no ARVs, and if they were there, people were buying, and they were very expensive.
We didn't have proper place to test the children. We didn't have place to counsel the children. We didn't have support any then, and we used to refer our children to Juba Teaching Hospital, where there was only one RRT center under the tree. And we used to have challenges with lots of follow-up. And most of our parents we send there, and the children, they don't come back.
Previously, actually, this community here had been suffering a lot. The TB, actually, they are having TB, but they don't know actually that they were suffering from TB.
The state of malaria in South Sudan was really dire in the years before the Global Fund came in to South Sudan.
Since 2004, the partnership started to fight HIV, tuberculosis, and malaria all across. Then Southern Sudan region of the Sudan, now the Republic of South Sudan.
Before the country can manage these resources, probably as an interim measure, there should be a principal recipient, that is a non-governmental, that can be able to manage and that can be closely monitored by the donor, that is the Global Fund. And so that is based on other global partnerships, we felt that UNDP is better placed in managing these resources.
We sat down. We considered there were many bodies that were interested in. The agency that was here which was a UN body, but had some roots in terms of operations. That was the one which was easier for us to have. This thing was floated through a competitive bidding. It was brought, we sat down, and then the UNDP was selected.
Together we have achieved tangible results in combating AIDS, tuberculosis, malaria, and strengthening health system.
The partnership is meeting, its objectives in making it possible that the people who are HIV positive are able to know their status, they are able to access treatment, and they are also able to live a positive life with reduced chances of transmitting the infection to others.
Global Fund came in with expansion. Global Fund came in with resources. Global Fund came in with system enhancement. Focus was put on these three diseases. And right now here at the Ministry of Health, we have a department for HIV, we have a department for tuberculosis, and we have a department for malaria.
This partnership has been pivotal in strengthening the country's health system, saving lives, and ensuring health care for people. 5.4 million people tested of HIV. 245 hospitals and facilities supported to offer HIV and TB services. 15 million insecticide-treated bed nets distributed.
For HIV, since we started all the intervention, the prevalence in this country was very high, almost close to 3%. When the Global Fund came in and supported the country with all the investment that we have received, we managed to bring down the number of cases as well as the prevalence.
UNDP has reached to the level of which is constructing the health facilities in some part of the state, and also has been renovating also some of the health facilities which are already been constructed by other partners or by the government.
Beyond the three diseases, beyond COVID response, which was actually very significant, whereby we were able to acquire for the first time oxygen plants in this country, together with an incinerator that is actually very, very competent. In installation of the solar power, we have done that in a number of our major hospitals in the country. Here, as the public health lab, I have mentioned it, Juba Teaching Hospital, El Sawa, the only specialized children's hospital in the country, has it. A number of our facilities, whether in Juba or subnational level, they're already having a solar power running now.
Before, solar was not insulated in Qatar. So many things took place, like government properties are stolen now and there because it was dark. You cannot detect the thieves coming inside. Midwives, they used to deliver mothers with touch of phone. The services was poor before. Even no more mothers are coming to attend labor here because they fear the security was poor.
Through the support that we are receiving from UNDP, we are really able to solve a very, very big, hectic problem that we were suffering from at the level of Rumbegi State Hospital, which is power. So some years back, we have a lot of issues to do with power, but thank God through this support and the project we are receiving, we are able to solve this issue completely. And now I can say and I can guarantee that we have a 24/7 power.
We do receive some patients from the bordering country. They are also benefiting from this service.
This community around, we do serve them. Then also, those coming from DRC Congo, because here we are bordering DRC. So they also do come here to this facility here. Then they're also getting the service here.
Global Fund has paid a significant amount of funding to support the salary payment of the staff, and which is a very good initiative. It ensures that having them motivated with this salary support.
With support from the Global Fund, South Sudan's healthcare infrastructure has been transformed. From small testing units to community health centers, life-saving treatment is now available for millions.
The government had a warehouse across the river on the Juba Ball Road, and that warehouse was not in use. It was proposed that why don't we put the resources into the other warehouse, so that instead of putting it in a commercial facility, why don't we strengthen capacity of the government?
The partnership's impact goes beyond just medicine. It empowers communities in health promotion, disease surveillance, prevention, and control. Support groups and community health workers trained and deployed to assist are an integral part of the success of this partnership. Behind every statistic, there's a personal story. Here's Mr. Loli, a champion of HIV awareness and treatment, affected and transformed by the interventions of the Global Fund Partnership. He lost 3 of his children and a wife.
In 1995, my child fell sick and died. And again and had another child, the child also died. Because there was no test to tell that she's living positive or is positive HIV and AIDS.
In just 20 years, the government of South Sudan, in collaboration with the Global Fund Partnership, has saved many lives, averted deaths, and strengthened health systems for future generations.
We are going to follow public financial management reforms to make sure that in the future we manage our own grant.
Through collaborative partnership and targeted intervention, more especially by Global Fund, we shall be able to make improvement in prevention, treatment, and care for those affected by these diseases.
Global Fund is the best of you, because Global Fund listen to us.
What makes Global Fund very unique, is number one is the country ownership. They only tell us that you have this funding available for you as a country. Now decide what you want to use that funds for, So we own the process as a country, we own the process. We sit down with everybody and we make our priorities.
Global Fund UNDP has actually shown resilience in difficult times, where we have insecurities, where we have floods, where we have other natural calamities.
Today, the journey is far from over. Continued support is crucial to sustain this 2-decade impact. With more resources, the partnership can reach even more people and build a robust healthcare system for all.
Moving forward, we should all work hard to sustain gains made, save more lives, and strengthen capacities of the Ministry of Health and other national institutions in the management of the grant.
That government should really put some resources in supporting the HIV activities. They should not leave it completely to the donors.
What I wish to see from my government is actually putting more money into the health sector. The health sector over the years has been getting less than 2% of the national budget.
The Global Funds Partnership in South Sudan is a story of progress, resilience, and hope. Together, we can help build a healthier, brighter future for all.
Young people living with HIV also have a